I wanted to bring today's episode to the podcast talking about infections and how they relate to your fertility. We see this all the time in the couples that we coach in our couples coaching program, having infections such as colds and flus and other infections as well, plus an infertility diagnosis. And this is something I have experienced firsthand. I had all kinds of infections such as sinus infections, bladder infections, yeast infections, and took lots of antibiotics for them. So we see this a lot too, people taking antibiotics and how that impacts the health of your microbiome or your gut health. So excited for you to listen to this episode, what you can do if you are struggling with infections, how this impacts your fertility. We're taking a functional spin on this. Excited for you to listen. Hey there. Thanks so much for listening to the Get Pregnant Naturally podcast. And I've got a favor to ask you. If you are enjoying learning about the functional approach to fertility, consider going to iTunes and rating and reviewing the podcast. This is how it helps the show reach more people that are struggling with infertility, knowing that there's another approach that really can get to the bottom of why it's not working in the first place. So all you need to do is, if you're on the app or the desktop, just go in and consider leaving a 5-star rating and leave a review. And there is step-by-step instructions in the show notes showing you exactly how to do that. So if you can just take a few minutes, just take the few minutes right now. You can pause this recording, come back, leave the review. It would really mean the world to me and help others that are on the fertility journey as well. Take care. Hey there. I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers. And really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to FabFertile, FabFertile.com and click on book a free call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's FabFertile, FabFertile.com, and click on book a free call. One theme that keeps coming up with the couples in our FabFertile couples coaching program is sleep. Whether it's insomnia, having a hard time falling asleep, waking up at night, or feeling tired when we wake up, sleep is critical for fertility and hormones. And that's why I'm so excited to have Blue Blocks as our podcast sponsor. So we're exposed to blue and green light from our phones, our tablets, our computers, indoor lights, and more. And this exposure impacts our melatonin production. And melatonin is essential for both female and male fertility. It helps determine the frequency and duration of our cycle and impacts sperm. There's lots of blue light blocking glasses on the market, but the ones from Blue Blocks, they've actually compared other popular brands, and Blue Blocks block 100% of blue and green light, while other brands fall short. So I have their sleep glasses. They have red lenses, and the ones I have are a little translucent frame, and they're so stylish and really cool. And so they eliminate 100% of the blue and green light in the 400 nanometer to 550 nanometer range. So this is the exact range that has been shown in clinical studies to disrupt melatonin and negatively impact your sleep. So all you do is wear your sleep glasses after sunset until it's time for bed, and you'll notice improved sleep after just one use. And it's also cool to use when you're flying for managing jet lag. So I got to say I was a little skeptical about the noticing improvement after one use, but literally I use these glasses and my sleep is actually already pretty good. I used them for one day, and I have to say after one day, I had the best sleep of my life. I just felt so rested. So these glasses, they ship free and they're tracked for all orders anywhere in the world. And also they have all their frames come in prescription, non-prescription, and reading glasses. Plus you can send in your frames and they'll add the blue light blocking and green light blocking lenses to your frame. So this is an easy hack that you can add to your fertility toolkit. All you do is go to BlueBlocks, BlueBlocks.com. Use the coupon code GetPregnantPodcast at checkout and receive a 15% discount. That's BlueBlocks, BlueBlocks.com, and use the coupon code GetPregnantPodcast to receive your 15% discount. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently, restored. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's often merely an assumption that's not based on actual evidence. The reason being that there is no direct test of egg quality. You can't test egg quality.
It's the man who's got a food sensitivity or he has a zinc deficiency.
Like there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why.
And some part of you knows that if you can reframe your journey from not want to struggle, or if it is struggle, learn how to embrace the struggle. Learn how to embrace it.
Most conditions in the child occur during the 9 months of development. It's the genetic switches are turned on or turned off, and they're pre-programmed. So you are in such a powerful, amazing position to do amazing things for your kids.
Why is IVF the first step? Because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, I'm Sarah Clark, the founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Elizabeth Boham to the podcast, and we're digging into chronic infections such as sinus, bladder, and yeast infections and what they mean for your fertility. Dr. Elizabeth Boham is a physician and nutritionist who practices functional medicine at the Ultra Wellness Center in Lenox, Massachusetts. And through her practice and lecturing, she's helped thousands of people achieve their goals of optimum health and wellness. And she witnesses the power of nutrition every day in her practice and is committed to training other physicians to utilize nutrition in healing. And Dr. Boham has contributed to many articles and wrote the latest chapter on obesity for the Rankel textbook of family medicine. And she's part of the faculty of the Institute for Functional Medicine, has been featured on the Dr. Oz Show in a variety of publications and media, including the Huffington Post, Chalkboard Magazine, and Experience Life. And her DVD, Breast Wellness, Tools to Prevent and Heal from Breast Cancer, explores the functional medicine approach to keeping your breasts and whole body whole. So you can check her out on drboham.com. And thanks so much for listening. I'm so thankful that you're here. Make sure that you hit the subscribe button. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Dr. Boham, excited to have you on the podcast.
Thank you, Sarah. It's great to be with you.
Yeah. So if you could share your journey, really how you came to do this work. I find most people have their own personal journey.
My undergraduate and graduate degree was in the field of nutrition. So I love nutrition. It's kind of my passion. I was working as a nutritionist. Then after I got my master's in nutrition and my registered dietitian, and I decided I wanted to learn more about all aspects of the body and how it works and how we can stay well. So I said, let me go to medical school. When I was in medical school, I realized that I wanted to figure out how to incorporate my nutrition into my medical school training. And as a lot of people realize, that a lot of times in medical school training, we're so focused on naming the disease and finding the quick treatment for it. We're not always focused, and we're not always learning enough about prevention and wellness and nutrition. So I really wanted to incorporate the two. That's when I started to learn about functional medicine, which really gave me a great map and tool to be able to incorporate my nutrition education and my medical school education, doing the two things together in this approach, in a functional medicine approach. And then when I was 30, so I was in residency, I ended up getting a triple negative breast cancer, which kind of threw me for a loop, as many people could imagine, because one, I was young and I didn't have any family history, and I thought I was doing everything right. I was eating well and exercising and trying to take care of myself. So I thought I kind of had it all figured out and I was going to be able to prevent everything, right? And then you get this disease, which is kind of scary and life-threatening. And so that was like 21 years ago. But it was at that point where I was also learning about functional medicine. And it was really eye-opening for me, because I could ask that question, why, right? And start to dig into what else may have been out of balance in my body, and what I really personally needed to focus on to keep myself well. And so functional medicine really assisted me both personally and professionally, being able to look deeper, look at how all the different systems in the body are interrelated, understand how we're all an individual. And for each of us, the reason that something may be out of balance can be very different. So when you take infertility, for example, there's multiple different reasons why somebody's body may not be working optimally, and it's all different. So we each have our individual story. And so I love practicing this way because I can spend the time to get to know each individual patient, learn their story, learn their timeline of their health, and then really figure out for them, what do they need to focus on? So for me and my health, I had to really focus more on detoxification, and because I have some genetic variations that impact that, my gut microbiome, stress management, right? But for somebody else with breast health and wellness, we're focusing more on diet and lowering blood sugar, for example. So everybody's an individual. And I think that's what's fun about what we do in functional medicine.
Absolutely. Yeah. Not focusing on the diagnosis. And then for you, you're able to reverse that, or what was your, because when you were 30, obviously you was diagnosed with that. So what was you said sort of some genetic markers and things that kind of came up for you, or anything you wanted to share?
Yeah. So I had some slight variations, or SNPs we call them, or single nucleotide polymorphisms, which were some slight variations in my genetic makeup that made me more prone to having issues with toxins from the environment. So I need to work a little harder in terms of all those things that help mobilize and get toxins out of my body. I have to work a little harder at avoiding toxins too. In addition, I really wasn't great at managing stress. And so that was an area that, even though I was eating well and exercising, I really had to focus from a lifestyle perspective on changing my relationship with the world around me, and how I reacted to situations, and how I viewed the world, and which really helped with me being able to calm down my body and calm down that sympathetic nervous system, and which is so critical for overall health, right? And in addition, when I was a kid, I had a lot of chronic urinary tract infections, was on tons of antibiotics, like from the ages of 5 to 16 plus.
Oh, that's young, yeah.
Chronic urinary tract infections and tons of antibiotics, which just changed my microbiome, all those bacteria in my digestive system significantly, as you can imagine. And that then we know influences so many things. Like it influences how you metabolize your hormones, and how you get rid of toxins from the environment, and just how your digestion works, which impacts how you get rid of toxins. So there's so many things that are impacted with that history. So that was another area that I had to work a lot on myself. For sure. Yeah. And that's something that I see with my clients and then myself, the chronic stress. And then for me, I had these infections. So today we're going to dig into, and yeah, thank you very much for sharing your story there. I think when we share it, it's really, people can kind of say, oh, wait a minute, that's me. So with the chronic stress, and then you had some gene variants, but I should think most people don't know they have those. Was it the MTHFR gene you have, or do you know which one it was? Or yeah, so I had a variation. I'm considered homozygous positive, which means both my alleles in my gene for the COMT variation. So it's also, COMT is also a methylation gene, kind of, similar to MTHFR in the fact that it's involved in methylation, but it has a huge impact on a few aspects of our health. It impacts how you metabolize your estrogen. So women who have this COMT variation can have more impact from estrogen, and because they don't get rid of it as easily, they don't methylate it and process it as easily. The other thing that COMT is involved in is how you metabolize adrenaline. So people who have a variation that impacts that enzyme are impacted more from stress. So something stressful happens, like having this conversation, or running running to catch a bus, or a big exam that you need to take, and your adrenaline goes up to handle that stressful situation. But people with that variation don't break down that adrenaline as easily. As a result, they're impacted more from that stress than somebody else who doesn't have that genetic variation. So they may have the long lasting impact from stress more. And that may impact the functioning of their immune system, right? That may impact just their anxiety level in their body. So we also know that impacts how much they feel pain in their body too, that whole fibromyalgia complex. So So it's an interesting genetic variation. So I had that variation, and I had variations in my glutathione genes, the glutathione genes that impact how well you can increase your glutathione levels in your body. So I had a couple of, I have a GSTM1 absent gene, which just means that it doesn't, I don't make as much glutathione. It's not as easy for me to increase my glutathione as somebody else, which really impacts how you're impacted from toxins in the environment. And you can do these there's different companies that do different genetic panels. The tricky thing I find with these genetic SNPs is you really want to work with somebody who has experience with them and gives you some good feedback, because there's so many different genes that we can look at. Some have a lot more data and research behind. Some we know more about, like how we can influence their expression through our lifestyle, but there's some that we can influence better than others, or we know how to influence at this point in time more so, or they're just more impactful in somebody's health. So sometimes when people get long lists of genetic SNPs, they get overwhelmed and like, oh my gosh, I don't even know where to start. So it really helps to work with somebody who has some knowledge and background in that area that can help that person really focus on what's most important.
Absolutely. I've interviewed Dr. Ben Lynch, and his book, Dirty Genes, is a really good, awesome book. I recommend it all the time, and just kind of talks about those. He has like 7 of the main genes he talks about. And a lot of that is like diet and lifestyles and simple strategies. And sometimes if you get the 23andMe, or I think he's recommending Ancestry right now. And then there's those programs that you have to then spit out the details. But it can be super overwhelming to do that. But a good starter on that is the book Dirty Genes by Dr. Ben Lynch. So I'd recommend that one.
Yeah, great.
Yeah, awesome. So today, like talking about repeat infections, and this is something, so I was diagnosed with premature ovarian failure at 28, had both my kids with donor eggs, didn't figure out that I had food sensitivities, gut infections, chronic stress until I was 40. I was fully in menopause. So I had all these things going on. And so I really want people because people that come to us is not just infertility. There's other health issues, and people kind of say, oh, I've had this for a while, or I've had that, and maybe common, but not normal. So what do repeat infections have to do with infertility?
Yeah, I'm so excited that you're doing the work you're doing and asking these questions, because that's so important to understand and to talk about. I think the biggest thing that repeat infections tell us and how that impacts our fertility is when you're getting repeat infections, it's saying something's not working right? Something's off in the body. And, we're not going to, women don't get pregnant as easily when there's stress going on in the body. And that may be emotional stress, but it can be physical stress too, right? So if you're not getting enough nutrients, if the body is under a physical stress for some reason, the body's smart. It's going to be like, well, maybe this isn't the best time to get pregnant, right? So when there is these repeat infections, it's telling us something's not working optimally in the body, and we've got to figure that out. So many times when the thyroid is off, that may be a reason that you can get repeat infections and have problems with fertility, right? Toxins from the environment both can impact your hormone levels in the body, and therefore, of course, your fertility level. And toxins definitely can suppress the immune system, can suppress how well the immune system works, and can be a cause of having repeat infections. We know that, for example, problems with digestion, absorption, malnutrition, all of those things can result in being more prone to getting sick, getting repeat infections, and of course, that's related to your fertility level. So one of the things I think is so critical is that we've got to get a really good detailed history from our patients, right? So I spend a long time gathering all that information so I can figure out for that individual patient, where do they need to focus? And because it's all connected, all of our systems in our body are interrelated. And so just because we're having issues with fertility doesn't mean that it is just a fertility issue. It's just a hormone issue. It's just there could be all these other things going on. And when we figure that out, that can really help improve our hormone balance, improve our cycles, improve our fertility.
Yeah, and we see this all the time with thyroid issues is something I experienced as well. So hypothyroidism, undiagnosed Hashimoto's, subclinical thyroid is the thyroid. So we see that's been missed, and with the infections and the toxins. And yeah, and we see that a lot with people being on long-term or women being on long-term hormonal birth control, and then that eating that really organic, nutrient-dense diet, and then really being, as you were saying, malnourished, not able to absorb the nutrients. We see that a lot. And that was the case for me. I'm eating this like great diet. And I did my hair tissue mineral analysis test, and I was like low on everything. And we see this quite regularly.
Yeah. So when you want to ask your physician to look deeper at your thyroid, get a full thyroid panel, TSH, free T3, free T4, but also look for thyroid antibodies, because sometimes thyroid numbers may be normal, but if there's thyroid antibodies, the thyroid may not be working optimally. And so we've got to do what we need to do to help lower those antibodies and help the thyroid work better. And sometimes we have to give a little thyroid hormone to help a woman get pregnant. So it's important to think about all aspects of what's going on. But I always say to people, if you're having these chronic infections, okay, you've got to take a step back and say, why? What's the issue? And then we've got to deal with that issue, because we've got to stop that cycle.
Absolutely. Yeah. So I had chronic bladder, chronic yeast, chronic sinus, and I didn't stop to say why. I took the antibiotic similar to what you did when you were little, from 5 to 16. I was in my 30s, but I didn't even step back to, wonder what was going on. So can you talk a little bit about antibiotics and how that impacts our gut health and our immune system?
We are covered. We are covered both inside our gut, inside our vaginal area, inside our mouth, but also on our skin, right? We are covered with good bacteria. They estimate 2 to 3 pounds of us are actually good bacteria. And that good bacteria is a critical part to our functioning of our immune system. So it's part of those good bacteria, you could call them probiotics, but all the good bugs that line our body and our digestive system, those bugs are part of the innate immune system. They are out there preventing the not so good bacteria and viruses or parasites or yeasts from getting a hold in our body. So they're really important to have enough of these good bacteria lining all the passages in our body and being part of that important immune system. When you take an antibiotic, which sometimes you need to do, you have to really pay attention when you're sick and say, okay, is this antibiotic really necessary or not necessary? I think that's an important question to ask. But when you take an antibiotic, you're going to kill off some of the bad bugs, of course, but in that process, you kill off some of the good bacteria. So we see this cyclical infection all the time. If you take bladder infections, for example, you take the antibiotic, it kills off the bacteria you don't want to have, but then it kills off some of the good bacteria. So the next time you're exposed to the E. coli bacteria, that, it's more likely to grab hold and cause another bladder infection. So it's sort of every time you take an antibiotic, you're weakening your own immune system. And we see repeated infections regularly. Or let's say with a sinus infection, somebody takes an antibiotic to get rid of the sinus infection, but then they get a cold or some viral infection afterwards. We see that all the time, again, because the antibiotics are getting rid of some of that good bacteria, which is the first line of defense in your immune system. I think what's really critical here in terms of antibiotics is, we are blessed to have them, right? We're blessed to have the option to be able to give antibiotics, but it's really important from a physician perspective, from a patient perspective, and, from a food industry perspective, we can talk about that in a second, to really use them minimally and only if absolutely necessary. And so you want to have that conversation with your doctor and say, okay, is this really needed at this point in time? Can I wait a few days? Is there any other options? What else can I do, right? Because I only want to take this antibiotic if it's absolutely necessary, because you want to have it available when your body needs it. But when we're taking it regularly, we're just getting rid of all those good bacteria, which are critical for our immune system. And there's so much interesting research on probiotics and how they impact the immune system. We know that when we give infants, and so much more to learn here, that's for sure. we need to do a lot more research in this area to understand it better. But we know when we give infants probiotics, we can decrease the risk of getting pneumonia or sepsis, which is an infection in the whole body. We know that probiotics can be associated with decreasing risk of even getting the common cold or certain pneumonias. So there's a lot more we need to learn about probiotics, but they have a really interesting benefit for the immune system. But even more important, we want to just focus on not damaging our good bacteria in the first place. And from a food supply standpoint, we know that a lot of, there's a lot of antibiotics used in our food supply, unfortunately, because the antibiotics help cows grow bigger, faster, stronger, well, I don't know about stronger, but get bigger faster. And so unfortunately, they've been being used in our food supply for a long time. And that's, of course, impacting our microbiome and how well our immune system is working or not working.
Yeah, and this leads into our next question so sinus infections. After I had my daughter, I remember getting 9 colds. Every cold that year went into a sinus infection. And I went to the doctor. I remember always running to the walk-in clinic and getting the antibiotic. I didn't wait to see if the cold would, or the sinus infection would dissipate, which it does when you use the neti pot and other sorts of things. And actually you try to rest and it goes away. I took antibiotic after antibiotic. Yeah, my immune system was just really, really compromised. So can you talk about some of the common causes of sinus infections?
Yeah. So, one of the things we see all the time is food sensitivities. Mm-hmm. Many times certain foods can increase congestion in the nasal passageway. And then when there's more congestion, that can sometimes get stuck and get infected, right? So if you're not getting the congestion out of the nose with using like a saline nasal spray or a neti pot, or you're getting more congestion because you have allergies or food sensitivities, then that's a real common reason for sinus infections. And so I think that dairy is probably the biggest culprit. One of the places we always start when people have a lot of congestion post-nasal drip, they're always blowing their nose and they haven't done a trial off of dairy. We sometimes test them for signs of an issue with dairy, or we just pull it away and see, does that help lower the nasal congestion? There's other foods that can do it as well. That's for sure. I've had some people where it was wheat gluten. Some people where it was more of a nut or seed issue, sesame seed, everybody's a little different, but the most common is dairy from a sinus perspective, and then gluten. Those are kind of the most common culprits. And so we'll often put somebody on an elimination diet where we pull away those foods for a period of time and add in things like the saline rinses or neti pot, just to help with getting rid of some of that congestion and breaking that cycle. As well as adding in probiotics. There's certain probiotics that are really helpful for prevention maybe of repeated sinusitis. So, those kind of things can help break that cycle.
Like a certain strain? Well,
they have they're different formulas that they're looking at, different strains, and there's some that are really focused on, they'll kind of focus on, they're called ENT probiotics or something. They're more focused on replacing the good bacteria in the sinus area. Oh, but yeah. I think all probiotics can be really helpful there.
Mm-hmm. I know my husband, literally, he'd be sitting there with a bag of cheese curds and saying, these are so delicious. And then 3 days later, he'd have the worst sinus infection. I'm like, I think there might be a correlation.
And there might be a connection there.
Yeah. So he's dairy-free and gluten-free now. But for years, it was like, oh, wait a minute, what's going on? And he had those seasonal allergies. And literally, he was telling me as a kid, he would literally, like 6 or 7, his mom would have to put hot compresses on his eyelids to pry them apart in the morning because they'd be so stuck together. And with all these, the postnasal drip and all that. And then, years later, he discovered it to taking out dairy and gluten, wheat as well. And then what about, so I see a lot of people, and myself included, with the cold flu. So now that I've changed my diet, worked on my stress, and dealt with the gut infections, I don't get as many colds and flus. If I do have one, I can typically look back and go, oh, that's what you did. You overdid it here. You maybe ate something there. So I can kind of like correlate it back. But how do we stop that cold flu cycle? Because a lot of people I see get those recurring infections.
Yeah, it's such a good question. And now in this time of COVID-19, right? It's such an important area for us to focus on. I think in this area, I always focus on those lifestyle factors first and foremost, and they have a huge impact on our immune system. We know, for example, there's so many people who are not getting the adequate amount of certain nutrients that are really critical for the functioning of the immune system. And people always think, well, we're not seeing a lot of nutritional deficiencies, but when we look, we do see a lot of nutritional insufficiencies and even deficiencies, which impact the functioning of the immune system. We really focus a lot on increasing nutrient density, meaning that you want to get the most nutrients per calorie in your diet. You don't want to waste your calories on things that are really nutrient poor, right? The muffins and the pancakes and the things that, of course, cookies and desserts, but like just the breads, the white breads, they're calories, but not as nutrient dense. So we really work on increasing nutrient density for people because we want to help increase some of those nutrients that are really critical for the functioning of the immune system. So you think about zinc, you think about vitamin A, vitamin C, iron. These nutrients are really important for the functioning of the immune system. And when they've done research looking at in the United States, over 40% of people are deficient or not getting the recommended intake of many of those nutrients. And so, no wonder their immune system's not working in the optimal form, right? So you really work on, for zinc, it's oysters are like the winner there. They've got like the most zinc per calorie, but all animal protein, beans and legumes, nuts and seeds are rich, pumpkin seeds, rich in zinc. Vitamin C, of course, you're talking about all of your citrus fruits but also your green leafy veggies and spinach, rich in C, kiwi, vitamin A, the retinol, the fat soluble vitamin A, rich in eggs and liver even, and some animal protein and, iron. Those foods we want to make sure people are getting really nutrient dense. And I think from a nutrition perspective, we've gotten a little lazy, thinking like, okay, well, I'm just going to grab a muffin here. I'm going to grab this here. And, we do start to see some insufficiencies, which impact how well our immune system works, how well we fight off colds and flus, and in the long run, how well our fertility, how well our hormones are working. We know, and you mentioned it too, and I see it all for myself too, stress, if we're not taking care of ourselves, if we're not giving our body time to rest and to sleep, then our immune system doesn't work as well. We need that 7 to 9 hours of sleep. We need the stress reduction techniques, the meditation, the going out in nature, stopping, not working all the time, right? All those things that really help our immune system work its best. And movement and exercise. So we know that when we're doing regular daily exercise and movement in a moderate fashion, that's like the best thing we can do for the functioning of our immune system. So getting on a good regimen like that really helps the functioning of our immune system, makes it so we're less likely to get run down, get that virus that's going around, get that infection that's circulating, and really stay well and healthy.
Yeah, it is focusing on those basics. You can't out supplement a poor diet. So it's, the diet. So that, like you're saying, a nutrient dense sleep, which is key. We work on with our couples and our couples coaching program for months on sleep. And then also movement, getting in. It's interesting now I was working at home all the time because that's just how my business is. But a lot of people now are working at home, and my husband, I'm downstairs working, and I'm like, okay, you need to go for a walk, because he doesn't even take a lunch break now. Because we're thinking, it's a different, all of us have kind of gone through a big change in this last little while. So being able to take those breaks, and then the mental emotional side of it, even going through infertility in itself is stressful. And then being able to, like you're saying, those meditation and those lifestyle factors are key for sure. And then, so another one that I experienced was these chronic UTIs, and it just got it literally, what did I do? I went off and I took antibiotics for all of them. At one point, I actually thought I had fleas. I'm like scratching like a crazy person. I fumigated the whole entire house with a whole whack of toxic chemicals because I thought the dog had given me fleas, sprayed the dog down. No, I actually had hives from the antibiotics, peeing blood, and I didn't really know what to do, not until I changed my diet and figured out the food sensitivities. And I still am, if I still can be prone to them a little bit, but now I know how to look at it naturally and not using antibiotics. But if someone, and I see this a lot with our clients, that they've had chronic UTIs, bladder infections. So how do we break the cycle?
Absolutely. So, one of the most common reasons that women get urinary tract infections after they're sexually active is just our anatomy, right? Our urethra, where the urine is coming out, is very close, relatively close to the rectal area. And so it's easier for those bacteria to kind of get to where the urethra is and climb up. And with sexual intercourse, that process almost pushes or encourages the not so good bacteria to go up into the bladder. And so it's really important for women to make sure that they urinate before intercourse, they urinate after intercourse, they're drinking enough water. It's because when you're keeping your urine dilute, it's less likely to be a problem. You're going to flush out those bacteria and not allow them to grab hold and get stuck and cause an infection. Even some of the basics of wiping from the front to the back. But I think, those things are really important and make a difference. And I've been so helped, and so many of my patients have been helped with cranberry D-mannose.
Yes.
So, oh my goodness, it's like a miracle. Yeah. Both cranberry and D-mannose prevent. They're two different, like cranberry from like cranberry juice. Though if you do the juice, you want to do 100% cranberry juice, no added sugar. Or you can get capsules that are like a powdered cranberry. And then there's some capsules that come also with D-mannose, or you can take D-mannose separately. But both cranberry and D-mannose have components that prevent the bacteria from sticking to the bladder wall. So they prevent that from happening, which is phenomenal. Women, you can take cranberry and D-mannose as prevention, and you can also take more if you feel like the symptoms are coming on, to prevent it from becoming a full-blown infection. You just need to you do want to, if you're really having a lot of symptoms, or if you do see blood in your urine, you do want to be talking to your physician, making sure that, you're not letting this go, because the infection if a bladder infection could potentially go up into the kidneys, which is it's a dangerous thing. You don't want that to happen. So, you don't want to just ignore it, but there's a lot you can do to prevent it from becoming a full-blown infection that goes on to need antibiotics. And I find probiotics critical here, just taking oral probiotics. And sometimes we have patients, mix, or we get compounded vaginal probiotics, and that can help with decreasing the bladder infections. There's some probiotics, that are like lactobacillus, reuteri. It's more likely that those are the kind of good bugs that prevent bladder infections. So there's some that are more specific for that area.
Yeah. And for me, I was not drinking enough water for years. My urine was, almost brown. I just wasn't really drinking enough water.
Right.
That's been changed. And then also the D-mannose has really been helpful. And also for me, I sometimes wouldn't even know I had a bladder infection, because it changed from the frequency to urinate to just like, why do I have a headache? And then, my back's a little bit sore. Oh, it's a bladder. And so a couple of days would go by. I'm like, oh, that's what it is. So it has for me changed over time, because that is one of my kind of weaknesses in the body, say that sort of the tipping point of if it's food or stress that seems to bring one on. But now with the D-mannose and the cranberry, I'm able to manage it.
Yeah. It's interesting how we all have like our little Achilles heel, right? What is our area which I think is what this is all about, right? When we're doing the functional medicine approach, we're really figuring out for that individual person, what's their Achilles heel? Where do they need to really focus?
Mm-hmm. And then, so for me, I also have chronic yeast infections. And this is something, I remember someone saying that my cervix was tilted in a weird way, and that's why, it's just basically, it just was always the yeast party going on down there, and not really fun. And went on for years and years. And I did a lot of anti-candida diets and things like that. Not until I figured out the gut infection side of things, and so and the food sensitivities. Because you could talk a little bit about the yeast infections and what you're seeing there.
Yeah, one of the things we know is that our microbiome gets established during birth and breastfeeding, right? So what our mother's microbiome is will impact our microbiome. And if you're born by C-section, you're not going to get all that good bacteria that you would normally get when you go through the vaginal canal. Though they have started to do some research looking at if we swab a baby after they get born by a C-section with the bacteria from the vaginal cavity, that might be very helpful. And so that first, those first part of our early days in life really impacts our microbiome and how at risk we are for developing overgrowth of yeast. And so it's all about balance. Of course, we all have some yeast in our body, but if it overgrows, if it gets out of hand, then it can cause all sorts of things and problems like a vaginal yeast infection or athlete's foot or thrush in the mouth, right? Or itchy scalp, right? Or yeast on the skin. So really that's just a sign when there's those things that your microbiome is out of balance and there's been this overgrowth of yeast. And as I said, it can start from really early on, or of course, all of the antibiotics that we take or get exposed to can then get rid of a lot of the good bacteria, which allows yeast to overgrow. And then, of course, our diet has a huge impact, right? So if we're drinking a lot of alcohol, we're eating a lot of high sugar foods, that then just feeds that yeast and allows it to get established and to take over. And many women or men too will notice, when they take an antibiotic, then they have problems with yeast, right? So everybody kind of sees that connection. I think probiotics are, again, really supportive here, both oral probiotics. Sometimes there's some compounded vaginal probiotics that we're using, and then diet that's really helps feed the good bacteria. So that's really the high fiber diet that's rich in prebiotics, which help feed the probiotics. So you're really, really building up that good bacteria in the body and avoiding the antibiotics and really cutting out a lot of the high sugary foods, refined and processed foods, fruit juices. Of course, we have people cut out a lot of alcohol. We work to cut down on, which can help get that under better balance.
Yeah. So I noticed this in my early 20s, and all of a sudden I started getting dandruff. I was like, what is going on here? Dandruff all over the place, using all these, anti-dandruff shampoos, and then the fungal rash. And then looking back, yes, there was some alcohol consumption during the university days, and I had this major sugar, like sweet tooth, and those antibiotic use. It's interesting. I haven't had the issue with dandruff in like years, and I had to take an antibiotic because this is ridiculous, but I got shingles because I thought like an old person. But anyways, I had to take an antibiotic, and then I'm like, what is going on with my scalp? My nails fell. Like, I have really good, strong nails. My nails just broke and became brittle. My scalp was itching and a disaster. Yeah, it's interesting with all that. So that's kind of my.
It's all connected like that.
Yes.
And especially if you're like, not everybody has that. They take an antibiotic and they just develop a yeast infection right away, right? Or signs of the overgrowth of yeast. But if that does happen to you, that's just a sign that you're kind of closer to that yeast overgrowth balance, maybe because of your long-term diet or how your gut microbiome was established from your mom and your younger years, or lots of antibiotic use, or even heavy metals. We know that there's certain, toxins from the environment that just make us more prone to having problems with yeast. And so, we have to think about all of that.
Yeah. And let's talk about that. So the environmental toxins, so lead or anything else you'd like to talk about there, of how that impacts infections.
Absolutely. So, we know that heavy metals, but also plastics and xenoestrogens, which can be xenoestrogens, which means that, a xenoestrogen means that it's a chemical from the environment that can actually impact the estrogen receptor in the body and throw off our hormone balance. So xenoestrogens could be things like plastics like BPA, that hard plastic, or pesticides, phthalates, other plastics, parabens that are in a lot of skincare products, for example. Those things can disrupt your estrogen receptor in your body and impact fertility, for example. But heavy metals, those other toxins, they're pervasive in our environment, unfortunately, and some of us are more impacted by them than others of us for a whole bunch of reasons, genetics, as well as just our exposure, as well as how well other systems in our body are working. And we do know that many toxins one of the ways they really damage our health is that they disrupt our immune system. So many toxins can not only weaken the immune system and make us more prone to colds and flus and sicknesses, but they can also shift the immune system and make us more prone to autoimmune disease, right? So unfortunately, toxins kind of have this double-edged sword in a sense, where they can really damage our immune system in a few different ways. And so when we work with people, we're getting a good history. We're thinking about, okay, what toxins may be a problem for them, whether it's a lead, heavy metal, or mercury, or arsenic, or some of the pesticides or plastics. So you want to just think about what may be the problem for that person, but also work to lower their exposure and work to help them get rid of these toxins from their body, from everything from having good bowel movements to sweating, through exercise, maybe even sauna use, lots of fiber in their diet, which helps with binding to a lot of toxins and getting them eliminated, increasing cruciferous vegetables, broccoli, cauliflower, cabbage, kale, which have components in them that help the body produce the glutathione and help with detoxification. So all of these things can really help improve how you mobilize and get rid of toxins.
Yeah, we just had an episode with Wendy Myers talking about those heavy metals and kind of some strategies to check that out. So definitely go check out that episode. And we also we see this a lot where people come with their infertility diagnosis and then, oh, by the way, I have an autoimmune disease. Or when we go through the testing, we don't diagnose, but they actually discover they have an autoimmune disease. And it's interesting you're talking about that with the environmental toxins too. And so let's dig into, and you've talked about some along the way, but anything else you'd like to say about some diet and lifestyle recommendations to combat infection?
We always take a food first approach, right? So, because that's what I started this, discussion with talking about my love of nutrition, right? But one of the things we know is how bad sugar is for the functioning of the immune system, right? When our blood sugar is higher than it should be, our immune system doesn't work as well. We know this. So, we're taught in medical school, right? We're taught that when you're working in the ICU, right, you've got a patient in the intensive care unit and they're getting IV nutrition, it's really important that you don't let that blood sugar go too high, because if you do, then their immune system won't work as well. They won't recover from that body infection. Maybe they have sepsis, a full body infection, or they have something going on that puts them in the ICU. They won't recover as well if we're not keeping that blood sugar under good control. So we know that that's critical for how well the immune system can function. And that is, I always start there with patients is, okay, we don't want to have that blood sugar spike. Whatever we want to do is don't let that blood sugar spike. So, don't have juice first thing in the morning, or, the breakfast of pancakes and syrup and orange juice. That's not good for the blood sugar, because all those things are really easily absorbed into the body, causing a spike in blood sugar. And then that spikes your insulin, which then takes you down that pathway of gaining weight around the belly and insulin resistance. And that can throw off your hormones and cause PCOS and everything, right? But just from an immune system perspective, those spikes in blood sugar are not good for your immune system. So instead, you'd want to have maybe an omelet with lots of vegetables in it and some berries on the side, right? That would be, that has good healthy fat, good fiber from the vegetables and even the berries. It has good protein in the eggs, right? That's a more slow, steady rise in blood sugar, a more balanced blood sugar. And that's going to prevent those spikes in blood sugar, which we know are not good for the immune system. What's critical, I always tell people, think at every meal, you want to think about fat, fiber, and protein. You want to have a good protein source, you want to have a good healthy fat source, and you want to have a good fiber source. And, that really helps with balancing blood sugar, which I think is really one of the best things we can do for our immune system.
I love that. I do that on a Saturday morning. I'll do the omelet with the berries. It's like so good.
Yeah, it's my favorite.
Anything else? So basically diet, like it's the same approach that we take as well. Anything else around sleep or exercise or stress reduction? Anything you want?
They're just so critical. You kind of say you want to keep yourself on track. Some people need to keep a journal to do this. They write down, okay, how much sleep did I get? Did I give myself time to get those 7 to 9 hours? Did I do some relaxation exercises today? Did I do my meditation? Right? Did I get my exercise today? Did I get outside? Did I get my exercise? Did I make the right food choices? And sort of like give yourself a little checklist. Okay. Did I do those things that are so important for my immune system and my overall health? Did I do something fun and relaxing? Right. Those things are really important and necessary. And so often we just kind of get in this treadmill of life, right? We just go, and we don't stop and give our body time to rest and recover, which it has a huge impact on the functioning of our immune system.
Absolutely. And are there any supplements? You've talked about some probiotics, but anything else that you'd recommend for supplements?
Yeah, I mean, I think that especially when we're in this realm of fertility, I think it's really important that women are on a good prenatal vitamin before they get pregnant. One of the things we know about the benefit of a prenatal vitamin, right, is that it has enough folate in it. And folate comes from your green leafy vegetables, but folate's really important for prevention of neural tube defects. So, but it works when you take it before you get pregnant or really early on when in pregnancy. And so, if you wait to start, in the second trimester, it's not going to really have its greatest benefit. So, you want to start taking a good prenatal beforehand. And I always tell people look for one that has methylfolate in it, not folic acid. Look for a higher quality prenatal that has like a methylfolate and activated folate at 1,000 micrograms per day is what's recommended. So a good multi, I think, is a great place to start. Many people need extra fish oil and vitamin D, and those are probably my top, basic supplements for people.
Absolutely, I agree. Now, is there anything you're obsessed with right now? Be it a book, a website, an app, a documentary, anything you'd like to recommend?
One of the things, again, once women get pregnant, is this website Grow Baby. A couple colleagues of mine put this together, and it's got phenomenal information about nutrition, good webinars that you can learn from. You can look at your diet and really improve your diet. And have an optimal pregnancy that way. So that's kind of one of my go-to for women.
I love it. Grow Baby. Perfect. And is there a success story you'd like to share with us?
Yeah. So, I have a few success stories from the fertility perspective. But one was a 28-year-old woman who came to see me. She was just getting frustrated because it had been a year, and she and her husband were trying to get pregnant and they haven't been able to, and she couldn't figure out why. She thought she was pretty healthy. And so when we gathered, we got really a lot of good information from her, got her whole history. And, she was one of those women who just didn't really complain. She was just a doer. She wasn't like a real complainer. And so she didn't really say, oh yeah, her digestion was pretty good. It didn't really bother her. She was a good eater. She ate lots of different foods. And, but when I did her physical exam, I started to notice, her hair was a little dry. She was definitely on the underweight side. She, even though she was a good eater, she was always a little bit underweight. Her skin was a little bit dry. So I started to worry a little bit about some nutritional deficiencies. And when we did testing, we saw a bunch of nutritional deficiencies. We saw she was low in B12, she was low in zinc, she was low in iron, and she was low in protein. A bunch of her amino acids were low, which that's kind of surprising. She's a good eater, she wasn't really complaining of digestive issues. So we looked further and realized that she had celiac disease. And celiac disease is an autoimmune process where the body fights off the villi in the intestine, which helps increase your surface area and absorb all your nutrients. She really, we do see this with celiac disease. Not everybody has digestive issues. And so this was a situation where she didn't really have any real issues until she was just not getting pregnant. And then when we dug deeper, we realized she did have issues. She had a lot of nutritional deficiencies, but not enough to really bother her that she noticed, right? And so when people have celiac disease, we have to take them off of all wheat, all gluten. They have to be off of all gluten because for them, gluten is the trigger for this autoimmune process, which is damaging how well they're digesting and absorbing their food. And of course, it's tied in with all other autoimmune diseases. So it can be connected with Hashimoto's thyroiditis or an autoimmune disease damaging your ovaries or all sorts of autoimmune conditions. But for her, we took her off of all wheat gluten. And we replaced a lot of her nutritional deficiencies. We gave her the zinc she was low in, the B12. We gave her extra calcium because she was low in that, and iron and protein and amino acids. And so, she needed to gain a little bit of weight. So she did actually gain like 5 or 6 pounds, which she needed. And she just had more, she didn't realize she didn't have good energy, but now she's like, I have so much more energy, and her hair started looking better and her skin started looking better. And then within about a year, 3/4 of a year to a year, she got pregnant. So that was really exciting.
Yeah. I know that celiac can take up to, I think it's an average of 10 years or 11 years to be diagnosed. Sometimes people don't even realize.
It's wild, isn't it?
Mm-hmm. Mm-hmm. And you've got a free download for the listeners here. And this is all about breast wellness. So prevention, high risk. If you're at high risk, you can go to Dr. Boham, drboham.com. And there's a free ebook there. Can you share with the listeners kind of what they'll get with that ebook?
Absolutely. So with my history and everything I went through, I was like, okay, I really want to talk about how we look at breast health and wellness, what we can do to prevent breast cancer, either the first time or a reoccurrence, or just decrease our risk, and look at it from all the different systems in the body. So I put together a DVD called Breast Wellness, which is also available on my website or on Amazon. But I took some of the information from the DVD and put it into this free ebook that you can download, and you learn about detoxification and how it relates to breast health and wellness and your gut microbiome and those xenoestrogens we were talking about. Talk through some of that stuff in more detail.
Absolutely. So that's critical for all women. So thanks for compiling that for us. Excellent. So definitely go check that out at drboham.com. And thank you so much for coming on and sharing your words of wisdom on this topic. I could talk all day long. I just love the thing you're doing, and thank you so much.
Oh, thank you, Sarah. Thanks so much for having me. And thank you for all your great work.
Awesome. Melatonin is important for female fertility. It helps regulate hormones and maintain the body's circadian rhythms. Plus, it helps determine the frequency and duration of the menstrual cycle. Plus, it impacts sperm count and motility. Blue and green light negatively impact our melatonin production. That's why we recommend Blue Blocks, blue and green light sleep glasses to all our one-to-one clients. Simply go to Blue Blocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast at checkout to receive your 15% discount. That's BlueBlocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast. Hey there, I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers, really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to FabFertile, FabFertile.com, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's FabFertile, FabFertile.com, and click on Book a Free Call. I'm excited to offer you a special gift. If you are a U.S. resident, text Fertile, FERTILE, to 55444. You'll be prompted to enter your email address and you'll receive our Fertility Yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to our heart. These simple yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. For U.S. residents, text Fertile, FERTILE, to 55444. For non-U.S. residents, go to Yoga Freebie, FREEBIE, to access your special gift. That's yogafreebie.com to access the free Fertility Yoga download. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.